Access to quality and affordable health care is a fundamental human right, yet it remains a luxury for many in our society. Nigeria Today Spotlight will be shining on the challenges of achieving affordable health care, exploring innovative solutions to make healthcare more accessible for all, from the role of government and healthcare providers to the impact of technology and community-led initiatives in healthcare. We'll be examining the factors that influence the healthcare systems. Thank you for joining us on Nigeria Today. I am your carrier, Clinton. Now with me in the studio to discuss achieving affordable healthcare in Nigeria is Dr. Obioma Obikeze. He's a Managing Director, Healthnomics, HMO PLC, Abuja. It's a pleasure to have you in Nigeria Today.
Thank you very much, and welcome viewers.
Also with us in the studio is Dr. Isaac Eboja. He's a public health specialist. You're welcome to Nigeria Today.
Thank you very much. I'm glad to be here.
Now we're talking about achieving affordable health care in Nigeria. Now looking at the system we have today, how would you assess our healthcare system?
Our healthcare system has evolved. Efforts have been made. We are far from where we would have been if no actions are being taken, if no efforts are being made. I give some credit to the current government in the several steps they have taken. An accident victim today is not expected to suffer the way they suffered some 5 years ago, because there is a program in place that assists such persons, especially pregnant women who come in to have delivery. The government has a plan for them that is actually working across the 36 states and FCT. And a lot of innovations and reforms have taken place, have been put in place in our health financing system. Just September 1st to 4th, there was the National Health Financing Dialogue, where a lot of steps were taken to look back at where we are coming from, what have been achieved so far, and what must we do to get to where developed countries are. Those who participated will give you, we assure you that there is hope for Nigeria. I'm one of those who believe that there is hope for Nigeria, but more actions need to be taken.
Thank you, Dr. Obikeze. Now, Dr. Eboja, we have heard, of course, quite a lot has been done. But, like Doc said, there's still more to be done. Now, if you look at the healthcare system, what would you say, what are some of the challenges you can point out to say, okay, these are some of the challenges we need to fix to have, affordable healthcare system?
Okay, let me start by saying that, yes, a lot of effort is being made to improve and strengthen our healthcare system, but we still have a long way to go. Why? Because our infant mortality rate is still very high. At the moment, it stands at about 55 live births per 1,000, for 1,000 live births, whereas the African average is 42, and the global average is 26. And our maternal mortality rate at the moment is about 576. And as a matter of fact, it's a little higher than that. And the African average is 545. And the global average is 233, which tells you that we have still a lot of work to do. Now, coming to the system in itself, one of the ways we would try, or we would be able to provide affordable, good quality healthcare that is universal, especially in our country, is to make sure that primary healthcare in particular continues to be promoted, continues to be funded, continues to be improved, and continue to be monitored closely. Why do I mention primary health care? Because most of our people live in rural areas. And as a result, when somebody is sick in the rural area, he is more likely to have problem getting health care than those who are living in towns. If you take Abuja, for example, for every 1 kilometer range, you would find a health facility of some sort. But that is not true in rural areas. So we need to focus on that. We need to build more primary health care centers, equip them, man them, improve them, and monitor them. We also need to strengthen our insurance, the National Health Insurance Scheme. It is doing very well, but it can do better. And if you notice, or if you know, it is those who are largely in government employment, either at federal level or state level, that are enrolled in the National Health Insurance Scheme. One of the ways we can improve that and strengthen that is to make sure that it goes everywhere, not just those that are employed by the government, private sector, individuals, communities can also enroll. And one of the innovative ways we could do this is those who are wealthy enough, who can give back to their society, who can give back to their communities, can pay for those who cannot pay, so that we can expand our safety net for those who need help, but who cannot afford it. And talking about this, let me talk about the accessibility issue.
I'll have to stop you here so that we'll talk about the accessibility issue in a short while. But let me bring back Dr. Obikeze here. Today is Universal Health Coverage Day with the theme, Unaffordable Healthcare, we are sick of it. Now, talking about affordable healthcare, what does it mean, or what is affordable healthcare? What does it really mean?
Affordable healthcare, simply put, is making the numbers, making the cost more of mutual accountability. A situation where you pay for care when you get to the health center. No country of the world has recorded affordability by paying out of pocket. But by the time you institute reforms that allow everybody to be hooked up to the health system by a prepayment mechanism, which is health insurance, you'll find out that 1,000 persons bringing 50,000 naira each have brought 50 million naira or thereabout. And out of those 1,000 persons, in any particular month, less than 10% of them will fall ill. And what does it mean? The aggregate money of 900 persons who are not sick at that time, their money is aggregated together to treat those 10% who are ill. So the affordability factor is pulling monies together to make the treatment of the few something that the system can pay for. The moment we get it this way as a country, we're out of the woods. It's a solidarity system where everybody brings his own little amount according to ability to pay. Someone who is earning 20,000 naira in a month can drop 1,000 naira out of it, even 200 naira out of it, as premium for health insurance. The person who is earning 1 million can drop 17,000 as his own premium. This is earnings-related contribution. But health need is according to, healthcare is according to need. It is the person who is sick that will go there. So this person who has contributed 17,000 may not go to the hospital for the next 7 months, but every month he's contributing 17,000. The person who contributed 200 naira, because the person is of low socioeconomic level, may get sick more. You are not treating him based on what he contributed, but based on need. Why? Because there is a solidarity system where everybody is pulling money together to take care of those who fall ill at any point in time. That is the affordability factor. It does not mean making hospitals to crash down the cost of care. It is not possible anywhere on earth. But pulling a lot of money together makes it affordable for each individual that has contributed to that pool. There is no time the amount that is spent in treating someone will be equal to the bill that will be given to that person if paying out of pocket. Let me take it again. If the bill for cesarean section is 250,000, that is because that is the actual cost of it. But whoever is receiving that care should not be billed according to what the hospital is saying, but according to the shared bill by everybody to make sure that that cost is paid. Those who paid 200 naira will access 250,000 naira cesarean section. Those who paid 25,000 naira will access the same care. Why? Because it is not only the person who is ill that contributed, the entire community has contributed in small, small amounts, in the understanding that only a few out of the millions of Nigerians will require care at a particular time. That is the affordability factor. Solidarity. Everybody is contributing to the pool. Thank you.
Thank you, Dr. Obikeze. Now, Dr. Egboja, the way he sounded, you know, from the way he's analyzing it is very, very, very beautiful. If we have that kind of system in place. And earlier on, you also mentioned that not just the, you know, government workers should have access to this kind of thing, or even the private workers, but then everybody, even the market woman, people in the communities, people in the rural areas, should have access to this health insurance scheme that he just talked about. Now, let's just say, okay, this kind of system is in place. How can we make it work in our own clan here? Because we have a lot of policies, we have a lot of, will I say, structures
and laws
here, a lot. But the problem here is making it work. So how can we make such work?
Okay. We can make it work because, first of all, let's go back a little bit. Even if you're able to afford healthcare, but the service is not there, then you are in trouble. So when we are talking of affordability, we also link it to accessibility. They go hand in hand. And when we talk about accessibility, we are talking about physical access, meaning that there should be a health facility within your neighborhood, within your place of residence. WHO stipulates that within 5-kilometer range of every community, there should be a health facility. Unfortunately, as of now, we don't have that situation. That's physical access. Financial access is the other arm of the problem. You could have a health center close to you, but you may not have money to pay. That means you don't have financial access, even though you have physical access. The other way around too, you could have plenty of money, like I said before, but there is no health center around you. So if, for example, you're a woman, you are pregnant and you need to deliver in the night, 2 a.m., 3 a.m. in the morning, but there's no health facility around you, you have the same problem as somebody who has the money, but doesn't have the health center, or who has the health center but doesn't have the money. So the two should go together, affordability and accessibility. And when we talk of accessibility, we also associate it with quality, not just that the health service is available, but that it is of optimal quality.
Healthcare.
Yeah.
All right, we'll take a short break now. This conversation will continue shortly.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that are questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today.
Welcome back. This is still Nigeria Today, and we are talking about achieving affordable health care in Nigeria. And I have two specialists here, two public health specialists here in the studio with me for this conversation. Now, Dr. Obikeze, of course, we've talked about affordability, just like Dr. Ewoja said. Yeah. Affordability, accessibility, and
even availability.
Okay.
It needs to be available, to be accessible. So those two, we have to go together. And if there is availability and accessibility, but not financial ability, you are back to square one. So he just captured it very well.
Yes.
The supply side has to be there, which is available services, available infrastructure, available commodities, before you can think of the person who is coming that has the money to access it. You may have a bag of money, but the service is not available. So the supply side has to be in place before the demand side, which is the patient that is demanding the care. Those two have to balance, and it's a mutual accountability.
So what do we do to make it available, accessible, affordable?
That is what I said. There is a need for mutual accountability here. Both the individual Nigerians and then political commitment from the government. A situation where the primary health care center, as Oga mentioned, either available but in disrepair or not available at all, there is a heavy crisis. So even if you buy insurance for every Nigerian and the primary health care is down and out. We had a conference 25th to 27th of November at Barcelona Hotel, reimagining primary health care in Nigeria. The data we saw was horrible. Less than 50% of primary health care centers in FCT are in good shape. So if FCT, where the president operates, has suboptimal functional primary health care, your guess is as good as mine for remote areas. So there is need for political commitment from the government to put the primary health care facilities in order, secondary health care facilities by the state governments, and tertiary ones by the federal government. Even with the facility in place, it will not manage itself. The human resources are also required. Japa syndrome has made a mess of health workers in Nigeria. The more the days are coming, the more people are finding ways to live. One thing I admire about the present government is bringing policy interventions to address brain drain. The Minister of Health has done a lot in that regard. Working with the Ministry of Education, there have been increase in the number of quota for admission in medical schools. Schools that have been graduating 100 have got up to 250 admissions, some 300. And gradually, we believe that the facilities for their training will also be upgraded so that the quantity of trained and certified health workers that are coming out will be able to handle the lapses and the gaps that are created by Japa syndrome. So it's a whole of system approach. If you have health insurance for everybody and there is no supply side to take care of them, we are back to square one. So I think he captured it very well. Availability, accessibility, both physical, geographical access, and financial access. Those are the two components that Nigeria needs to be able to get ahead.
Okay, we've talked about the place of government. Government, you're talking about the political will, like you mentioned. Now, what is the role of the private sector in trying to help us achieve affordable healthcare?
This is a very important question. Very, very important. Why? Because in Nigeria, we always point to the government. Everything is government. Everything is government. I think we, especially as far as health is concerned, we need to know that everybody is a stakeholder as far as health is concerned. It doesn't matter whether you are an employer or an employee in the public sector or in the private sector. As long as you are a citizen of this country, you are a stakeholder. And therefore, we should not always be talking about government, whether you mean government at state level or at a local government level or at the federal level. We should also be thinking of communities and individuals and talking about innovative ways of bringing or making quality healthcare available to Nigerians. One of the things that we can do, especially in this month of December, and I'm challenging those who have plenty money, who are going home for Christmas, to do this. If you go to your village, rather than showing off and spending so much money, throwing it anyhow, why don't you contribute some money to the health facility, whatever health facility that is in your council ward? That is in your council ward. It doesn't matter, for me, it doesn't matter whether it is private or government owned, as long as there's a functioning health facility. There should be one. And if there's none and you have money, and I'm challenging Nigerians, let them please, instead of throwing money around, wasting money, put it into use. Support the healthcare system. There are Nigerians who can build primary healthcare centers by themselves. There are Nigerians who, if they team up, 2, 3 to 5 people, can build a primary healthcare center or can build a ward where women who are pregnant, who need delivery, can deliver safely. Or they can contribute money, and that money can be used to buy equipment with which to deliver babies cleanly and hygienically so that they can survive. So these are innovative ways we can think of, or we can improve our healthcare system such that they will be affordable and accessible to everybody. And let me come back a little bit to our politicians. If you have a lot of money, especially this, what they call it, the money they give to each parliamentarian, constituency allowance. If you take a good chunk of it and throw it into health, go to your local government and find out if there's a healthcare center that you can fund, either improve it, build a ward there, help them to buy equipment, or help them to buy drugs that they can use in giving to patients. Whatever way, that's a contribution. So let me emphasize on this. Every stakeholder should bring something to the table. Yeah. Let us not only look at the government, whether at local level, state level, or federal level. Yeah. Let us look at we individuals. And for those of us who are privileged to have some money, let us think of how we can improve the health care facilities in our council ward, if there is one. If there is none, take it as a challenge. Build one. Build a primary health care center in your council ward, if there is none. That's a contribution.
Thank you. Thank you very much, Dr. Ewoja. So, Dr. Obikeze, what would be your closing thoughts on this, on achieving affordable health care?
I want to believe that 2030 is by the corner. And that is when the global community will be reassessed as to how far we have gone in achieving universal health coverage. My attraction to the current tax law that will come into effect in January is that it's trying to do what UK has done since 1948 when the National Health Service started. National Health Service of the UK is run on tax money. A proportion of the aggregate tax of the government is devoted to health. That is why every single person in the UK has access to health care. We can repeat that here. If we have a costing of what it will take to deliver quality and affordable care to Nigerians, government and private sector bring their own to be sure that the supply side, the hospital, the human resources required, the health information system, commodities and organization, everything is done on that side. And we have enough to make sure that anybody who is requiring care doesn't have to pay out of pocket, that is when Nigeria will be out of the woods. And it is doable. It is doable. Beyond the tax system, I want to also believe that the findings of National Institute for Policy and Strategic Studies, Senior Executive Cost 41 in 2019, their findings can help this country out of the wood. That taking 1 kobo or 2 kobo from every cost of call per second can revolutionize the entire health system by putting in so much money into the system. The calculation in 2019 was that whereas BHCPF was yielding 58 billion at that time, this method I have mentioned is capable of yielding 280 billion. So there are a lot of innovative ways that Nigeria can achieve universal health coverage.
Thank you very much, Obioma Obike's Managing Director, Healthnomics, HMO PLC, Abuja. Thank you so much for coming and sharing your thoughts with us on this issue of achieving affordable health care in Nigeria. And also a very big thank you to Dr. Isaac Ibuja, public health specialist. Thank you so much for coming on the program.
My pleasure.
And thank you for being part of this program. I'm Mikaria Clinton. Goodbye.